Hey everybody, it's Lyme Disease Awareness Month. What does that mean? Now, before you turn me off and you think you can't possibly have Lyme disease, just wait 1 minute and let me share with you what Lyme disease is all about. Because so many people think that they can't possibly have Lyme disease. They don't spend time in the woods. They've never seen a bullseye rash. They don't ever remember a tick bite. But if you're sick chronically and you have these weird symptoms that come and go and there's no pattern to them, like one day your elbow hurts, one day your knee hurts, then it's an ankle, you're getting brain fog, your memory is poor, you can't recall things, you're forgetting words, you're irritable, you're explosive, you're angry, you cry a lot, you're so fatigued you can hardly do the day's work that you need to do, then this video is for you because you could have tick-borne illness. Maybe it's not Lyme disease, but maybe it's another tick-borne disease like Babesia or auriculosis or anaplasmosis or mycoplasma, chlamydia pneumoniae, which is not the sexually kind. But there are all kinds of different infections that could harbor in your body that can cause you to feel the way you do. And I want to encourage you to seek out a practitioner at Serenity that can help you identify exactly what's causing your symptoms. We have lots of tools and gadgets to help us find the answers because it's not all about blood testing. Did you know that blood testing is less than 50% accurate when it comes to diagnosing Lyme disease? It's true. And co-infections like Babesia and Bartonella and auricula and anaplasmosis, less than that. Maybe if we're lucky, 25 to 30%. And that's why so many people go undiagnosed for so long. You don't have to suffer. At Serenity, we want to partner with you and we want to be your medical detective. We want to unlock what's going on in your body. We do that in a variety of ways. We have a biofeedback machine called an OnDemand that helps us scan your body for bacteria, viruses, and parasites, over 3,000 of them. We have a bioscan machine that can also tell us what part of your body is being affected right now by whatever it is that's going on. So in less than 25 minutes, we can have answers to exactly what's causing your issue. Treatment, it doesn't have to be long-term antibiotics anymore. That was the gold standard for a long time. And do we use that? Yes, we still do. But there are new modalities that we can use. There's something called a photonics, which delivers light, UV light, which we used to be only able to do by IV. But now we can use this UV light sublingually to kill bacteria, viruses, parasites, to increase your energy, improve your cellular structure, improve something we call ATP, which is basically fuel for your body and for your cells. It also can help speed up metabolism and help with metabolic stress on the body. We have ozone therapy, which is amazing, where we can take some blood out of you, inject some IV ozone, which is just oxygen, into the bag of your blood and give that back to you to kill bacteria, viruses, parasites, and energize you at the same time. So you see, there are all kinds of things that we can do today that we weren't even able to do 5 years ago. And Serenity wants to be the leader in Lyme disease treatment. So we are looking at new modalities every day to bring to you. We vet them and make sure that they've been around, they've been studied, they're safe, and more importantly, they're effective. Because when you're spending your money on Lyme disease treatment, we understand how expensive that is without insurance coverage, and we understand how long it takes to get improvement. So if you've been struggling or you've only been using antibiotics and you don't feel like you're getting any better, I want you to call and talk to one of my team today and let them know that you're interested in having a conversation about other modalities that are available. One modality that's been around for a long time that works beautifully is called LDA. LDA is an antigen therapy where you simply put a drop underneath your tongue, which can get the immune system to stop recognizing the infection as an immune reaction, kind of like an autoimmune disease. Yeah, it's true. Your infection can turn into an autoimmune disease. and LDA helps us turn that off. Now, every one of my practitioners at Serenity Health Care Center are knowledgeable about these modalities. I urge you, call today, talk to your provider, or talk to one of our nursing staff about which modality might fit you if you're tired of using antibiotics. We need to get on top of Lyme disease before it gets a hold of you. And it's important to be aggressive. That's why we use antibiotics. But when antibiotics fail us, we need an alternative. And these are some of the alternatives that we're bringing to you right now so that we can help you and your body heal from Lyme disease. Let everyone know it is more common than people realize. According to the CDC, there are over 300,000 new Lyme disease cases every year. We know that number is substantially lower than what it actually is, but that's what's reportable at this time. There are a number of people suffering from Lyme disease and don't even realize it. It's not on their radar. They would never even think it was Lyme. We need to help all of those people. So spread the word. Anyone can get Lyme disease, from sitting on the bleachers at your son's ball game to hiking in the woods and even gardening on that city lot that you don't think there's any ticks around. Lyme disease is everywhere. It has touched every corner of our continent, and it is not going away. It's here to stay. So let us help you heal your body in a way that gives you your life back.